Pathophysiology on diabetes. It's a serious health problem throughout the world because its prevalence is increasing rapidly. The long-term complications of diabetes are making a devastating disease because diabetes is the leading cause to adult blindness, end-stage renal disease, and sometimes non-traumatic lower limb amputations. It's also a contributing factor to heart disease and stroke. Diabetes is a chronic multi-system disease related to either the abnormal insulin production or impaired insulin utilization or both. The causes can be genetic, autoimmune, and or environmental factors. But as I mentioned before, whatever the cause is, diabetes is due to the absence or insufficient production of insulin and or poor utilization of insulin by the cells. So anatomy. Insulin is a hormone produced by the B cells in the islets of Langerhans in the pancreas. Under normal conditions, insulin is usually released into the bloodstream in small portions and larger portions when food is eaten. Again, under normal conditions, the actions of insulin being released into the bloodstream lowers blood glucose to a normal range of 70 to 120. This is because insulin promotes the transport of glucose across the cell membrane from the bloodstream into the cytoplasm of the cell. Other hormones like cortisol, epinephrine, glucagon, and growth hormone counteract the effects of insulin. They work to increase blood glucose by stimulating glucose production and the output of glycogen by the liver, and they work to decrease the movement of glucose into the cells. So when a normal production of any of these or all of these is present in diabetes. Skeletal muscle and adipose tissue have specific receptors for insulin, and they're considered insulin-dependent tissues. Other tissues like the brain, liver, and blood cells, they're not directly dependent on insulin for glucose transport, but they do require an adequate supply to maintain normal function. So the American Diabetes Association, or ADA, recognizes the two types of diabetes. The most common types are classified as type 1 or type 2 diabetes mellitus. Type 1 diabetes is autoimmune. The body itself attacks the cells of the pancreas, which disables the ability to produce insulin. This is why type 1 diabetes requires artificial insulin injections. The type 2 diabetes, the pancreas usually nobody wants cookies. Type 2 diabetes, the pancreas usually continues to produce some insulin. However, insulin that is produced is either insufficient for the needs of the body or is poorly utilized by the tissues, or both. The presence of some insulin is the major pathophysiological distinction between type 1 and type 2 diabetes. Many factors contribute to the development of type 2 diabetes. The most powerful risk factor is believed to be obesity. Also, genetic mutations that lead to insulin resistance and higher risk for obesity have been found in many people with type 2 diabetes. There's 4 major metabolic abnormalities that have a role in the development of type 2 diabetes. The first factor is insulin resistance in glucose and lipid metabolism.